Hypertrophic cardiomyopathy is a genetically transmitted disease found in about 1 in 500 patients. It is characterized by a localized thickness of the heart muscle that is close to the outflow area where the blood comes out from the heart into the aorta.
What happens every time your heart is trying to eject blood from your ventricle, it faces an obstruction that is abnormal. Once the aortic valve opens, which is the end of the heart and the beginning of the vascular system, you don't have enough blood to perfuse your body. So when you try to do things, you feel short of breath. You can't do the things that a normal person your age are able to do.
At Valley Hospital, we have created this multidisciplinary program for hypertrophic cardiomyopathy to improve our patients' outcomes and satisfaction and treatment. We have to understand that the prevalence of hypertrophic cardiomyopathy is pretty high, 1 in 500 patients. For that, they should go to be evaluated by primary care physicians and should have at least 1 EKG when they're young in order to see if they have hypertrophic cardiomyopathy or not, or if they need more testing. And the beauty at the Valley Hospital that even an EKG done in primary care physician office, if it's something abnormal, it will flag our program, and then we evaluate and see if there are any concerns for possible hypertrophic cardiomyopathy. We can consider further workup like an echocardiogram or an MRI. For treatment of hypertrophic cardiomyopathy, we have multiple options. We can use either classical ones like beta blockers or calcium channel blockers as verapamil, but also we have a new medication that treats and improve significantly the symptoms of hypertrophic cardiomyopathy. Other people might better benefit from a surgical approach.
Prior to us doing any operation, to mimic this patient in full exercise mode, we raise the heart rate to 150, 160 beats per minute, and we drop the blood pressure to see. That would be the worst situation for someone with this condition. That would be the highest likelihood of obstruction. And then once I repair the problem, then I do another echo at the time of at rest conditions, and then I provoke them again to make sure that when they are going to the gym and the heart rate is 150 beats per minute, there's not going to be any issue. Those patients go home in 3 or 4 days and they're back to normal activities within about 2 weeks.
Treatment for every patient is different, and every patient needs to be considered on an individual basis, and the tailored approach has to be performed. At Valley Hospital, we are using the teamwork approach. We have in our team heart failure specialists, electrophysiologists, interventional cardiologists, imaging specialists, and cardiac surgeons. We meet once a month and discuss more challenging cases of hypertrophic cardiomyopathy. To reach this hypertrophic cardiomyopathy program, you do not need to be referred by somebody. We have an open line that any patient can call, and we will evaluate to see if any further workup or evaluation is needed.